Assalamualaikum. Today we will tell about asbestos. Okay, now I will introduce my group mates. Okay, my name is Muhammad Alif Nazmi bin Hamidi. My student ID is 2019 444 392.
And so my name is Megat Irma Arif Megat Zahiran and my student ID is 2019 27 1216.
So hi, so today I'm going to explain about asbestos. So what is asbestos? Asbestos is naturally occurring material found in soil and rocks that is composed of fibers of carried size and shape. It is also resistant to heat and most chemicals. So next slide, types of asbestos. So according to Asbestos Hazard Emergency Response Act 1986, which is AHERA, there are 6 types of asbestos and it falls into 2 categories, which is amphibole and serpentine. Asbestos is made up of minerals fibers such as crystalline, actinolite, amosite, anthophyllite, crocidolite, and tremidolite, as well as any of these minerals that have been chemically treated or modified. So next, industry involved and uses of asbestos. So the industry involved, which is such as abrasive manufacturers, asbestos product manufacturing, chemical plant, construction industry, maritime companies, mining industry, offshore rust removal business, or refineries, paper mills, sand manufacturers, and also power plants. And the uses of asbestos, it is widely utilized in the manufacture of a variety of industrial goods, primarily ro- primarily roofing, insulating materials, ceramic floors, asbestos cement products, automotive components, brake and clutch, textiles, gaskets, and also protective clothing. Okay, the next one is routes of entry. The primary route of asbestos entry into the body is inhalation of air that contains asbestos fibers. Asbestos can also enter the body via ingestion. With dermal exposure, asbestos fibers may lodge in the skin. So next is inhalation. Inhalation, the air pathway is the most important route of exposure to asbestos. It is the route that is most commonly leads to illness. Exposure scenarios include inhalation of air that is contaminated during work with asbestos. So the next one is ingestion. Ingestion is a less important pathway of exposure occurs through swallowing materials removed from the lung, drinking water contaminated with asbestos, or incidentally ingestion during swimming in contaminated air. And the last one is the skin absorption. So appropriate use of personal protective equipment by those working with asbestos, dermal contact is rarely significant exposure pathway. Asbestos fibers could become lodged in the skin, producing a callus or corn, but not more serious health effects. That's all.
Assalamualaikum. Okay, next I will tell about asbestos related disease. First, asbestos related disease is asbestosis. Asbestosis, also known as diffuse pulmonary fibrosis, is a common asbestos disease that causes severe scarring of the inner lung tissue after prolonged exposure to the mineral. This causes severe pain and difficulty breathing. Asbestosis is not like cancerous tumors. It is not fatal, but it can cause respiratory or cardiac failure as the condition worsens over time. Okay, second is pleural plaque. Pleural plaque are calcified collagen form when a foreign substance such as asbestos fibers enters a person's body. A natural immune response may occur, resulting in the formation of pleural plaques. Pleural plaque form when the lungs and ribcage membranes thicken, resulting in a build-up of calcified collagen. According to the British Lung Foundation, pleural plaque are usually not dangerous and have no symptoms. Okay, after that, mesothelioma. Malignant mesothelioma does not just affect one part of the body. It can appear in several different areas and spread widely via the lymph nodes. This aggressive cancer is extremely deadly. There are 4 types of mesothelioma, which is pleural mesothelioma, peritoneal mesothelioma, pericardial mesothelioma, and testicular mesothelioma. Because mesothelioma can develop in different part of the body and the symptom can mimic more common, less deadly illnesses. Okay, lastly, lung cancer. Lung cancer is a common and deadly asbestos-related disease. While tobacco smoke, radon, and heavy metal are the most common causes of lung cancer, asbestos exposure is responsible for an estimated 20% of all cases. Tumors of the lung form in the inner pleural tissue. If left untreated, this cancer severely impairs lung function and can be fatal. This asbestos disease is treated with a combination of surgery, chemotherapy, and radiation. Okay, next is asbestos control measures. Okay, there are some of the control measure for the asbestos. First, turn off the air conditioning and cover the work area with plastic sheet. Then put on a respirator with a HEPA filter, which HEPA is mean high efficiency particulate air. During asbestos removal, wear disposable cover and glove. To keep asbestos material wet and dust suppressed at all time, use a pump sprayer. Clean the work area with wet wipes or a vacuum cleaner with a HEPA filter. Wet wipes or a HEPA filter vacuum cleaner should be used to clean the work area. Asbestos waste should be disposed of in clearly labeled bag at a landfill that accept asbestos. Okay, finally for the conclusion. Asbestos is one of the most common avoidable lung hazard. Although it's linked to a variety of malignant and non-malignant lung disease has long been established. New information about the pathogenesis of this disease is still emerging. In this context, the multiplicative effects of smoking on lung cancer risk in asbestos exposed individuals, the role of asbestos exposure duration and level in the development of pleural plaques and asbestosis, and the absence of increased risk for malignant pleural mesothelioma among patients with asbestos-associated pleural thickening or asbestosis have recently been demonstrated. Okay, thank you. That's all from me.